ask him what's your problem, and then you never know, is the shoulder pain problem of the neck or of the shoulder? What's the reason? And if I look at him, I would say his left shoulder is much higher. Give me your head to the left. Any pain? No? Other side wrong? No pain. Okay. Right shoulder. Stretch the arm. And with people working on the desk, on the PC, you will find they are not able to stretch. Yes, they're very often in this position or here, and if you stretch and let it loose, it goes back. Then you know shortening here. Next thing is, if you check the abduction, the people try to rotate to don't have the problem of abducting the arm. Always take care that the hand is in this horizontal position. And then go upward. And normally you should reach his head, but now it's getting not painful, but here's the shortening, right? And on this way, reduction here. He should come up to here. Yes, we have here about 35 degrees, and upward, yeah, 40, 45 degrees. Then external rotation is good. I always fix the scapula here. Internal it's gone. Maybe 50. Other side. Yes, much better. Okay, but even here, you could improve. What's your profession? Yes, you work all day with your hands. And right-handed, you're right shoulder. Yeah, okay. So I would start, as I told you, with the scraper. Who wants to? Someone who wants to treat him? It's a workshop, hands-on. Okay. Yes?
Yeah.
No one?
You can give us a demonstration first and then
Okay. 21 hertz, as fast as you can with the scraper, and you don't need much energy in this area. Even here you have to reduce. So let's start with 0.4, 0.5. Yeah? Give me your hand. It's not much. Check. Very light. Light. You think it's strong? Yeah. Don't forget the force. Sorry. The force doesn't go directly into the deep. You're tangential on the skin, so you should measure the other ones. So, first step, I grab his hand, extend his elbow with my elbow. I'm even right-handed, so I have a perfect first step. And I have a trigger band here on the inside of the arm, and there's a trigger band below the clavicle. Yeah? So you help me like this. So first step, 3 times, start here. Tack. Did you watch the reaction here? There was a small like this. So I know the first problem is here. Yes?
Again?
Painful for me, one of these. I don't know whether it's a trigger point, but it's there's more tension in the muscle.
Tension?
Yes.
You feel it with your fingers?
You can feel it without activating the device. Suck. Yes? You feel it, right? So I make a
Can I
mark.
feel it, please?
Sure. There's so much more here. We can much easier to detect. Next step, biceps. Suck. Here. Come on.
Please.
Suck. Very easy. Suck.
Oh,
Yeah,
that's
that's
good.
all. So you know, next. We don't know whether it's his problem, but I mark now all the points of more resistance in the tissue. And then the rest is free. Maybe here a bit. Okay? Suck. That 3 times from here. Reduce application pressure here because of tendon of the bicep and follow the course of this trigger. And people are very sensitive here. Press lower ankle. And with the shoulder stiffness, you very often see a combination of limited outer rotation and retroversion. So what we do in our daily work, I need your help. You grab his hand with the other. And with this hand, put away, you put this angle. And while I treat him, you do this, okay? But slowly. Then I try to treat slow. Okay, let's check. We compare. Big difference. Yes? So next step, this muscle. I ask the patient to keep his right hand with his left one. No tension in this arm, okay? Yes. I can start, this is not very important for me, but triceps maximus. Bring it up. So. Be aware here of the vessels and the nerves on the body. Stop. Finish. 3 times.
You need to rest with the application pressure.
Yeah, just a certain amount of pressure, really. And then watch his face, his eyes, and if the signs of pain are reduced. But he looks relaxed. So, check again. Oh, same position. Yes. And it's very fast. But he has to stretch. Here we have to work several times. Now we have the inner rotation, subscapularis. It's not really better because we haven't done it. So, same position. Then you have to. Yes. I feel here. Here. Is it painful?
Painful.
Yes. Some gel here. Oops. That's enough. $17, $16. Yes? Pressure the same. And touch the tissue where the resistance is. It's very strong, very hard. You feel? Is it painful? Normally, it should be very soft, flat muscle, but if it has a tension like he has, it's very stiff, and you always go with your shockwave around it, and it's very difficult to stay on the point.
What is you choose this
Yes,
hand. Why?
because I want now I'm working on the trigger point.
Okay.
Maybe I'm working on the muscle, on the fascia, but mainly on the trigger point. And you don't have much space here to work with the scraper or the knuckle. And the problem is, if you go a bit further, you're on the area where you have to be. It's my experience that it's quicker results. So again, let's check the inner rotation. Yeah, much better. So now we are still missing infraspinatus, supraspinatus, teres, here, maybe a bit biceps, yes? But this is a very quick setting, 6-7 minutes, and I don't have to change position of the patient. If he has neck problems, I can continue your own with the scraper on the trapezius. So now it's your turn. What's your profession?
Hematologist.
Hmm?
from the wrist.
Ah, okay. So, choose 21. Here.
Okay.
So, you start with the infraspinatus. You come from this side. First feel. Where do you think? Where is it?
Here?
Yeah, yes. There's spinous here. There. Sorry, this is the spine. So maybe it's somewhere here around.
Oh, right here.
Shara trapezius.
Oh, it's
No,
okay.
no, it's most of the time it's around here.
Shara infraspinatus. Shara
Yeah,
infraspinatus.
there it is. So feel. So some pressure.
Which muscle you are working on it?
Hmm?
Which muscle you are working on?
Infraspinatus.
Okay,
Yeah,
here.
around here. So follow the muscle with the scraper. And the thing is, if you want to feel, don't work like this or like this. You want to feel, so like this. So you get a response. Yes? And if it's, you should follow, so take it other way around. I would work so. Okay?
Like this?
Yes. Where is the spina? Wait. Spina is here. We'll stay away from the bone. This. Right here. You solve the problem here. Go again. Yeah. There's one more problem, right? Next step would be now work on the trigger. I normally make all my marks and then I change transmitter and go on the points. See, yeah? Problem of time. Now, trapezius, and have a look with him. This one is where he has a lot of tension here. Maybe make first this one and then this one. And start here. Don't go up to the slowly, slowly, slowly. You feel something in the system? No resistance here. This is the point, right? That was too fast and too light and without. Okay, good. Jetzt, now we did all muscles, normally maybe some here, and let's check the mobility now. You have pain or you have a reduced mobility?
No pain.
Pain or no pain?
No pain.
No. Once a week, 3-4 times. Some stretching exercises for home and maybe problem is gone.
Okay.
We did
Back
no
to the
tests
session.
now and no examination, but
For how long the session effects remain?
if he's lazy, it's gone next week. Maybe a bit. If he does some stretching, you see him always better result from week to week. It depends on him.
The increase in the range of motion will persist or it will not persist?
This was the question just now. It depends on the patient. I would show him now, very simple. Both hands and shoulders back. First exercise, second exercise. Zack. So, ja. Zack, schön. Ja, so rüber. Oh. In this case, if he's so stiff, I would put him on the side and continue from here all the way down. He isn't able to bend to the side.
These chains are available in any certain the chains of the muscle that you think about it.
Yes, you can use the shapes, the trigger bands from FDM. You find them all on the internet, and the rest is experience. In the beginning, the shoulder setting was 20-30 minutes for me with lying in this position, lying in this position. Then I started crazy, sitting down, and then it's the same, but much faster. If the stiffness is only this here, up to here, if it's up to there, you have to change. And it's very difficult for the patients to stretch these fascia muscles. there's something you can buy on the internet. You know these plastic rubber balls you can sit on. Yes, for dynamic sitting. You can buy them as a roll. It's called Physio Roll. Yes, you know it? It's 20, 30 euros on the internet. It's this wide, this high, then the patients can lie on the side and bend and stretch. Yes.
Can we see suitable position for supraspinatus tendinitis and biceps tendinitis? Just position.
For what?
Supraspinatus
Yes.
tendinitis and biceps. There's difference between.
Yeah, and for the biceps, I lay down. Biceps is, you find the trigger points much easier while the patient is lying on his back. You can do it with or without the device running. Here's one. If you are. It's just as effective as the roll is. You could see the. Try.
It's like your two.
Yeah, very easy. It's okay. There's one here. Maybe one. This is one thing for here. So, and then I would work on these ones. Yeah, very easy. And the same if you have the tennis elbow. You have the same problems in all these muscles here. But this is more difficult with this one. Here's more soft. Here's more tension in the muscles. It's better with the roll or with your fingers. Some gel on the skin and try to identify the muscle which is the problem. And it's helpful to you if the patients have problems here. Every pain spot is coordinated with a certain trigger point here. So check the internet, your app. Trigger points. It looks like this head. Real body works. Muscles. Now you can turn him around and say, I want to know what's here or what's there. Zack. And then you get the muscles with the different trigger points. Or you can search for muscles. You can fill in the name here, and it's perfect. Yes?
I want to see
It's real body works, and I think the name is trigger points. Let me check. But it's so helpful.
لا ننزل معاك ثلاثة
الكبيرة والصغيرة بس مش عندي دي.
My trigger points. No, it's too expensive. No.
What's the trigger points?
The Egyptian. Oh, sorry. I have to see the. It's a different picture. We can search it. No one you have. Here, this one. But I have the German internet. It looks like this. You need to have this picture. Muscle trigger points. We have even my trigger points in Germany.
May not appear in
Real body works. That's it. How much is it? 54.99. How much is it in euro? This is the right one. 3 euros. Yeah, same in Germany.
Can I see how it's done, please?
Yeah, sure. It's your seat.
muscle trigger point muscle trigger point muscle trigger point هي لو trigger point هتجيب كذا حاجة.
So now you want to check your trigger. Have a seat. Yeah. So you have more. Check this one. This is more simple. So you got it? The problem is if you check 4 or 5 times, then maybe it's gone. It's kind of tricky. Yes. Okay, and this one is gone. Relax your head. No, it's still there. Yeah, in the upper part. Yes. Now change transmitter. No? There are two ways. The first one is zack, but now we want to change the whole. So relax this one very quick. And take this one. We treat them and then we check again afterwards with this scraper. So now 17 or 16 and one bar. You have chosen the white one. It's very soft. Okay. Don't be afraid. We choose the white one. And try to find the point and to stay on the one bar. No, we have yes, one bar. But now we're ready. Yes. What I do like a pencil in my fingers like this.
The transmitter plastic or the
Yes, plastic. Yes, it was the one which was lying there. Relax your head. Always take care that the patient is relaxed. They always try to look what you're doing, and then they have tension in their body.
Fix it or rotating it?
Yes, rotating or stay on the point. It's effective. Yes, it's no impact. But I think it's more effective for solving the problem to stay on the trigger point. Until you feel, you don't feel that good with this one. You better feel with the flat ones. You can choose, and we can change it. Just 3 minutes, 2 minutes. 2 or 3.
You can use plastic or the focused one, no? Metal.
Yes. So, okay. So, very stiff here. Too painful? No, no? Okay. So, biceps, same here, with the tennis elbow or problems of the hand.
Supraspinatus?
Yeah, later, it comes next. So, wrist arthrosis I can show you.
It's better for the trigger point to use the plastic one or the oscillatory one.
Better would be this one, like this. Here.
This is the focused one.
No, this is the normal, not booster radio transmitter. It belongs to this.
Yes.
Looks like
It is a normal one.
yeah,
Yeah.
this is the normal.
Yeah.
I think the device comes with one
With
of
the
these.
3.
Two.
Two. We directly
في واحدة
bought with
diameters
the
بتاعتها
full
عالية
box, so I
شوية
don't
تلاقيها
know
موجودة
normal equipment.
اللي هي الكبيرة اللي هي دي.
الكبيرة دي
لا
بالثلاثي.
دي اللي هي دي مثلا.
في واحدة اوسيلاتوري واحدة
دي
فوكس
ستيب
وبيبقى
تو.
في واحدة جولد هو
دي
بيبقوا
ستيب
3 ستاندرد جايين
Good. It's more energy.
هم جايين 3 كده
More deeper, more tender, more deep. Yes. Yeah, yes. Thumb 0.3. Let me check. Your hand against my one. Bring it down. Oh. No. Don't fool me. Like this. Yes, yeah. Let me check. You have two ways to find out how to what degree or extent the problem is. The one is the degree of abduction. And the other one is the vertical mobility. It's okay with him. They are very restricted. Very often you find this area total fixed. But with him it's okay. This is something. So I would fix the muscle from here. The muscle is here, I would say around here. Yeah? What's your impression? Yeah. Okay. And then, if it's too painful, try to fix it from below, and then bring some. Okay?
You don't need a journey. You don't need a journey.
No, not here. Then you lose contact. It's even difficult to get contact to this small. I think it's 4 millimeters the muscle. And the other way around. There it is. Yes. You should treat it by yourself until the pain is gone. Very simple. You take these 2 fingers, one here, one there, search the muscle, a lot of pressure, 30 seconds, and afterwards take the thumb, and not like this, but abduction, yes? Now check again. But it's a bit better.
بتحرك لوحده خلاص. ده كويس.
This is not your problem. You see more effect with a patient who has really a problem. Yeah, but there was the wish for the supraspinatus.
Supraspinatus.
Yeah. Okay. Have a seat, please. This way your legs. I bring the arm in this position.
النهارده تنس.
Yeah. There. Now you have the choice from here, or you bring him in the face down position. Fix him out. Now we do it here. It works with this one. But I'm not sure how much is trapezius, how much is levator scapulae, and how much is supraspinatus. I think you treat all these muscles. It's okay? But if you work on the herniated trigger point here, you anyway bring vertical energy in this direction, because the application is like this. So, but up to now we do it now for this, the first prototypes 4 years ago, 5 years ago. Up to now, nothing. No problem with the lung. Hundreds, maybe more than 1,000 patients. I don't think that really a lot of energy will reach the lung. And if you once get a massage, classic massage, some of the therapists, they put so much energy with their fingers on your tissue. We sometimes have patients with acute lumbar pain. You know, if you go to a bath, they have these outlets where you can put yourself in front of water coming out, maybe 2 bars or 3 bars. Sometimes, just last week, 2 patients did this in the weekend, nice water here, and had acute lumbar pain because of these 2 bars coming to maybe to the nerve or to the muscles, who know. And the same they do with the massage. I don't think we have much more energy with this on this indication here. So.
Cervical.
Yes, it is difficult. We have the scraper. If there's a young patient, no degeneration, I would go in this way. Maybe put his head a bit, loosen your head, so, in this direction. And if there's no reaction of pain, I can go here. If I have a patient 46, I know from the X-ray there's a lot of degeneration here, problems of the joints, I stop here. And then I do the rest with my thumb. Yes? And we're waiting for the new transmitter with rubber on the upper side, and I can work here, even for the atlas mobilization, yeah, for the atlas therapy. The trigger points, as I showed you, in this position, or a more relaxed face-down position, finger here, working on the trigger point. Focused, same direction, focused handpiece. So, fingers away, otherwise it goes through. You will feel it in your fingers on the other side, a lot of power. So even if you treat focused the pain spots around the thumb, and you reach with the signal, your fingers, you feel it through the hand of your patient on the other side, reaching your bones.
What's more effective, movement or stress movement?
Depends on, I think I always combine. Do first the fascial treatment. If I do only one, I get, if I don't do the fascial part, I don't get this improvement of mobilization. If I don't work on the trigger points, yes, he keeps his pain, so I always combine. And if I try to work on the fascia with the radial transmitters, with the D20, I always lose the contact here. It's difficult to follow the path with energy. So I think the combination is best. Okay. Maybe this area, but it's very simple. Can you lay down on your face?
كويس الحمد لله. هنا الطاقة بتاعت البترول. أخبارك إيه؟
So, you check, okay? First without motor. Yes?
في المنزل.
Yes? First one? No.
فلوس المستشفى المطرية بس أجازة ليها 15 سنة.
Check. In reality, it's 15 seconds. One here, one there, and then you start.
حاسس ان هي تريجر بوينت كتير لدرجة مش قادر كيف هنا هي خلاص there is no.
Okay, start. So, once here, low pressure, high frequency. Start here.
Why stop?
Okay? Tomorrow you will feel like hit by a truck. Drink a lot today. Okay? So, I wanted you first to have an impression of our way of treating. And I want to show you some case studies. We can do it in this surrounding. This is a young lady. She had in 2011 an accident. You can look with us if you want. With the injury of her hand. And we met her in August next year, after surgery. And the hand looked like the left two pictures, totally stiff, totally contracted in this position. She was studying law, it was her right hand, everything was gone. She couldn't play tennis, she couldn't play music instruments, nothing. And what we did, and at this time, she had 180 physiotherapies, 180. She had a private insurance, money didn't play a role, but nevertheless, the hand looked like this. And we did a combination of focused and radial and fascial shockwave. We prescribed this additional aids for passive mobilization. And in the spring of the next year, in February, the hand looked like this. And they are still friends that we became friends, the family and us, because they wanted to go to court. Her whole future was gone, and they were very thankful. Next one is the patient. He's running marathon, 10, 15 kilometers every day, twice, 3 times a week. And he always again had the problem of his musculus vastus lateralis and the kneecap. Always again the same. He came always with the same trigger points. And after treating them with needling and shockwave, it was for a week okay, and then again the same problem. And this was for a year maybe. And he was totally fit. He knew everything about nutrition, about stretching, about trigger points, self-treatment, everything. But we couldn't solve the problem. And then we thought about what happened in the past we didn't think about. And one day he told me, when I was 6 years old, I had a fracture of my femur. And in this age, they get this wire through the bone and the extension with the weight. And then I thought, where do you typically do this wire? Yes, and the scuff was gone in the meantime. I was born in '63. We found the point, and there were 2 small trigger points in the deep. Yes, and we needled them, shockwave 2 times. Since then, I think more than a year, focused everything on these 2 points. Yes, and for more than a year, I didn't see it. I saw it now again because of some other problems, but this, how important the analysis is, the past. Yes, this small thing, the fracture at the age of 6 years. Next one, lady, born 37, strong paravertebral pain. And if you see this X-ray, every doctor will tell you it's normal. With this back, you have to have pain. Yes, she got injections, everything, and under the CT, injection of corticoid. And when I examined her, I found that she had very stiff muscles, paravertebral, from 6 to 10. And she had a lot of trigger points. We did dry needling, we did scraper, and since then she's pain-free. Crazy even for me. I would normally think, well, no wonder with your vertebrae, it's normal to have pain. And this is the case I told you before. In Berlin, every year in September is the big marathon. And 1 week before, this guy entered our clinics, and they had the idea of starting to run without any preparation. He's about 40, working the whole day, no stretching, nothing, and then they started running 10, 20 kilometers. And when he entered my clinic 1 week before the competition, the calf was like beton, like steel, totally stiff. And I treated him on the same day, and I said, I'm not sure because in your tibia I see this thickness here of the corticalis. Maybe you're getting a stress fracture. Tomorrow morning we make an MRI, and I treat you now because we have only 5 days. Next morning this MRI, and I have to go there to translate to you. And I didn't tell the doctor what we did. This was my fault. And this stands in German, I have fluid in the muscle, I have a rupture in the medial part of the gastrocnemius and in the lateral part, and in the lateral part of the peroneus brevis, and I have signs for shin splint syndrome. That means if you have an MRI like this after shockwave, it's normal. Yes, don't be surprised. It happens. A lot happens in the tissue. 1 week after we got this email, this is the guy, and he wrote, thank you, whole team, the marathon is done, the calf worked, and very important, there are many more calves to work on in my surrounding. Yes, you get good advertising. Okay, I think this was the last one. And this is what Marcus told you about the MP200 with the cupping. We have now 1 MP200, and if I have patients with calves, with adhesions between, who was the doctor who told me about this patient with the 2 revisions of the Achilles tendon? It was you. In these cases, you normally have the skin totally fixed on the tendon of the peritendon, and it's perfect with the cupping, or if you have patients after arthroscopy of the knee, and they have the inner scalp like inward, and then they have pain, and you make an MRI, they have degeneration, maybe small rupture again, and you're not sure what's the reason for the pain. Cupping. So this is the application guide. This is the book. Yes. Okay, now we're.
Can we see a session for the tennis elbow?
Yeah, sure.
I have a problem with my already.
Yeah. Where's the guy with the shoulder? Thank you very much. But I would do some shockwave on all this muscle once a week, stretching, and hopefully it's okay. You worked on the muscles of the back. It's very easy.
Yeah.
Yes. The tissue will respond to you if you are willing to listen to it, and then it's very quick. Okay, let me see. This one or this one? Tennessee outside. When you prefer to the main. You have the problem here or
Common flexor
He has both.
yeah. But your problem is here.
Yeah.
All the same procedure. No problem. It's okay. You're right-handed or left-handed? Okay. I always do the same checks to know whether it's. This is relatively good. You play tennis? How did? What was the beginning? Do you know the reason for the?
Overloading.
From work?
From massage.
Yeah.
From doing massage. His work as a
You have a limited supine. No, wait. Second. Yeah, stop. Let me see the set. There's a difference. Close your eyes and feel the rotation and feel here. You feel the difference?
Supination is easier.
It's shortened, and this I need more power to bring it to the end of. Yes,
Supination.
much more tension here. Okay, lay down. Now is the mechanism. So, okay. Who wanted to?
as a
Also, we need the scraper first.
Yes. The chair. Pencil.
And what is the dose again, please?
Hmm?
The dose, the frequency of the
Please
dose.
have a seat. You have to sit. You don't feel if you stand and like take a chair and sit down.
What's your opinion about this case? We apply, we concentrate on muscle or tendon in this case?
Oh, unmuscled. Yes. 70% muscle,
As we discussed.
30%
As you
tendon.
discussed before.
Yes.
How many bars here?
At first he has to examine.
Okay.
And it depends on, he has a lot of hairs on the skin, and the male patients are very sensitive because the hairs are drawn with, so it depends on. And what's your impression there?
maybe it's better to use gel with this case.
It depends on. If he's a strong man, we don't need gel.
Because of hair.
Yes, but not every male is not able to endure it. Let's
I speak about
those let's make it. But relax, lay down your hands. Okay? So start. Normally he would have to take off his shirt so we can follow the whole path, but in this case it's okay. So start. No. So always have a look. The muscle starts around here. Be careful here, so start around here. 45 degrees. Wait. Stop. We increase the so it doesn't stop every minute.
we increase the
So
shots.
now, okay.
It's 0.3 bar. 0.3 bar.
0.3, yes. But he looks relaxed, maybe 0.6. The problem is, don't make your own experience. All this knowledge in here is just a guideline. It depends, if he is very, he's tough.
Also depends on the machine. The machine when you use the
There's
compressors
more
work
power.
powerful.
After 2 years of use, it's losing power. There's a lot of factors. He is the big influence. Okay, good. So, next step, turn off the coupling. Put it there. This one. And now work on the point. And now 17. You have 17? Yes. In these cases, it's often helpful to fix this part with the other hand. Otherwise, you lose the contact to the. Need more gel?
Now he concentrates on the trigger points.
First, have a look. Where are the trigger points? Wait, it's more easy. Some more gel. With this slide. But don't forget about the examination according to FDM. Normally you would ask the patient, where is the problem? He will tell you, he would show you here, yes? Or he will show you there. If the patient shows you like this, then you know it's more an inflammation of the tendon at the transition.
The common extensor tendon.
Classic epicondylitis. If the patient shows like this, then you have to look for the fascia and muscles.
For the classic,
just on the spot. There. Yeah. Yes. We work on it. It's perfect for needling. Take a needle and look for the point.
if there is a classic epicondylitis.
Yes. You can work on the bone with a low energy.
How much is it?
0.3 maybe with the plastic one or ceramic in the beginning.
Because it's painful.
Yes, it's painful. Maybe with your idea of...
And should I rotate like this or I concentrate on the bone?
No, I concentrate in this case. I make an ultrasound, 90 degrees bending. Ultrasound, where is the inflammation? Make a mark on the skin and work on this place, or I feel.
Ah, okay.
What is? Let me find. Here, there's a big problem. No, in this case you can fix the trigger point between your fingers. First look for the trigger. No. First examine.
Please.
I keep it.
Yeah.
100 shots beside the target are 0 shots on the target. So you treat him and there's no success next week. So be sure you work on the point.
Yes.
Yes? Okay, fix it between your fingers, like this. The same way like I do it with dry needling. And now, okay? There it is. Now we stay on the point. And if I search trigger points in the buttock, I ask the patients for help. They're on the bench, face down. You take, and I ask them, give me your hand. Radial or focus, doesn't matter. And he's guiding the handpiece because he's feeling whether the shots hit the point or not. Pressure indicator. You can find. I don't know. You have it with some handpieces. You have it on the side of the So after this we have a break, otherwise everything is gone outside.
Yeah.
The next step would be for me, if you're interested, foot, knee, hip, and maybe pelvis. Okay, stop. Clean it. Change.
Sometimes we
transmitter.
we do here also.
Yeah, sure, the biceps. It's so many patients tell you I have my pain here. Now check again, is there any difference? No, it's okay. So. But then no gel is allowed. Let's check. Yeah. Yes, we have to work on the triceps and treat all the muscles which are involved. But I think you can't compare now. It's too much gel still on the skin. Try. Oh wait, he wants to check the trigger points again. It's less, I see. Yes? Okay. So, total setting, 7 minutes and 8 minutes every session. And if you then get 30 euros for the treatment with the shockwave and maybe 20 minutes for some additional manipulation and this, you have 50.
Or what do you do?
No, on the points I used like the same setting like we did with his
For bursitis.
for
Bursitis. Subdeltoid. Bursitis. The bursa. Inflammation of the bursa.
inflammation of the
Bursa.
Inflammation, bursa, bursitis.
for the bursa. No, sorry, no.
We don't
For
use.
the, no, for the bursa I take the focused, the bursitis. It depends on the degree of inflammation. If it's very painful and a high degree of inflammation, I don't treat them radial. We sometimes see patients, they underwent radial treatment in other clinic because they had only radial and it's much higher degree of inflammation, much pain.
Yeah.